You ready? Yep.
Ready.
You're going to just point to them when you're live. And then you're just starting to count.
Can we make sure everybody's phones are on silent or off before we start? We're about to go live. Good evening. I'm Dr. Lee Scheinbart, Chief Medical Officer of Hospital Services with Health First. I'm joined tonight by our Virtual Care Medical Director, Dr. Jade George. Welcome, Dr. George.
Thank you.
The past couple of months have been a little unsettling for all of us as we navigate through the COVID-19 pandemic. We wanted to take some time to share with you what Health First has done for our community and how we are prepared to take care of you and your family. But first, how about a little background on the two of us? I arrived in Florida in 1993, 27 years ago next month, upon graduation from The Ohio State University College of Medicine, where I earned my medical degree. I accomplished my postgraduate training at the University of Florida, Shands Hospital, where I specialized in hematology and oncology, as well as conducted research in immunology. It was in Gainesville where I met my future wonderful wife while we were both rotating through the VA hospital. We moved to Brevard County in 1998, and we have made this our home ever since. We have raised 4 wonderful children, one of whom was born 6 weeks premature during Hurricane Francis, and so we're no strangers to disasters. I've been involved with Health First on a variety of levels since my arrival 22 years ago, and currently I serve as the Chief Medical Officer for all 4 hospitals: Cape Canaveral Hospital, Vieira Hospital, Holmes Regional, and Palm Bay Hospital. From as early as January, even before the first cases of COVID-19 were diagnosed in our county, I have been materially part of the surveillance and the response team for our hospitals, for our health system, and for our community. Dr. George, why don't you share some details about yourself?
Thank you so much, Dr. Scheinbart, and thank you so much for having me here tonight. Welcome, everybody. I just wanted to take a moment to tell you a little bit about myself. I'm Dr. Jade George. I'm a family medicine physician with Health First Medical Group, and I'm the medical director for virtual health at Health First Medical Group. I received my undergraduate degree from the University of South Florida in Tampa. I went on to medical school at Nova Southeastern University in Fort Lauderdale, and I completed my family medicine residency at Florida Hospital East Orlando. I was born and raised in Central Florida, and I have lived in Brevard County the majority of my life. I have a wonderful husband, Grady, and we have 2 small children together. Thanks, Dr. Scheinbart.
Thank you, Dr. George. Well, let's take a couple of minutes to talk about how we here at Health First are prepared to take care of our community. I think the most important thing for you to know is our families are safe, and we are prepared and open to take care of you. Back in early April, we adopted a universal masking policy, which requires all who come through our doors to wear face masks. This policy gives our staff and our patients an added layer of protection, not only from COVID-19, but from any potential airborne or droplet-based illness. The universal mask policy applies to all who enter our clinical locations, such as our employees, our providers, visitors, and the vendors in our clinical care delivery. This is throughout our hospital environment, as well as Health First Medical Group and all of its clinical locations. Patients and visitors are provided surgical masks as they enter our facilities. Waiting rooms are kept sanitized, clean, and organized, with social distancing measures in place to protect both visitors, patients, and our associates. This includes requiring seating to be a minimum of 6 feet apart and plexiglass partitions between associates and visitors. To date, Health First has spent roughly $2 million on emergency supplies, services, and personal protective equipment, PPE, to fight COVID-19. Hospital emergency rooms and other rooms undergo a 7-step cleaning process to ensure high-quality cleaning and disinfecting. Our ORs go through a similar OR-specific 7-step cleaning process, and each OR room goes through the terminal cleaning process after every single surgical procedure and before the very next procedure. This is conducted by a very specialized team, and they are focused on the sterility and disinfection of the operating room. Health First is committed to maintaining the highest level of safety for both our staff members and our community. A service for our customers that has become very popular during this time is virtual visits, with social distancing remaining an important part of our approach and the new normal. This is a great option for those seeking medical care. Dr. George, would you mind sharing with us the option of the virtual visits and why this is such a great thing?
Absolutely. So as the COVID-19 public health crisis continues, virtual care has served as a really valuable tool for those who understandably don't want to venture out into the community and instead receive non-emergent care from the comfort of their own homes. Health First recently launched virtual visits for many different types of patient visits, from chronic care to urgent care, wellness visits, and more. Patients can keep almost all of their appointments that would normally be seen in the office and conduct those virtually, including things like the management of diabetes. We have more than 300 providers who are offering virtual visits in all different specialties, as well as primary care. We can figure much more out virtually than we thought we would be able to, and patients have the virtual visits since they are patients are really enjoying these virtual visits since they are able to do them from the comfort of their own home. The numbers alone show the surge in popularity. We're currently doing, on average, more than 1,000 virtual visits per day. And even our older patients who might be resistant to the technology are really embracing the trend. Virtual visits are also beneficial for our seniors who might have transportation issues, and it limits their exposure to other illnesses. It not only allows for continuity of care, but is one more way to strengthen the patient-provider relationship during tough times. Virtual visits can be scheduled 7 days a week between 8 a.m. and 8 p.m. And patients should call the Health First Medical Group Central Provider Scheduling at 321-434-3131 to set up a virtual visit.
Thank you very much.
Thank you.
Well, let's go into some of the questions. This is a live experience, and our moderator, Jenny, is off camera, and she'll be asking us some questions that we have received. So, Jenny, what's the first question tonight?
Thank you. So the first question is from Laurel. She's actually asking about what's happening overseas regarding relaxing restrictions, and what is our expectation around the incidence of new cases?
So I think the question is asking, what do we believe might happen here in Brevard County as restrictions are eased? The governor and his task force has put together a very robust plan for our reopening, and I think we do need to anticipate that there will be some increase in cases, but perhaps very minimally so. The steps upon reopening are very carefully crafted, and there will be key surveillance measures that we will put in place to monitor what is happening in our community.
Great, thank you. Also from Laurel, what is the latest research on whether one can get reinfected with COVID-19 after recovering?
So that's a great question, Jenny. The incidence of reinfection is not fully known yet, as we're all still beginning to understand all of the elements of this virus and its infection. The incidence of reinfection has not been widely published. I think it's reasonable to assume, like most viruses throughout modern history, once you've experienced the virus, you are likely to develop some type of immune response, and unlikely to develop an overwhelming second experience or second illness from the virus.
Great. Mia asks, what should I do to keep myself safe when I go to the store, a restaurant, or to the beach?
So again, a great question. I think that we need to continue to provide a sense of safety for ourselves and the people that we interact with. And the primary way to do that is through the use of social distancing. Dr. George and I are sitting at a safe distance from each other. There are reports that around 6 feet seems to be the number to keep distant between individuals. That's because the illness can spread through breathing, through talking, coughing and sneezing. And to the extent that those droplets that come out of someone who is expressing the virus will naturally fall to the ground or dissipate in the atmosphere, social distancing is number one. Number two, surgical masks, cloth masks, a variety of different masks will provide protection, a barrier from the egress of viral particles and a barrier to the ingress of viral particles are instrumental in preventing cases from being transmitted from person to person. And recent studies out of the Southeast Asia area have shown that when people are using masks and they have social distancing, there's a dramatic decrease in human-to-human transmission.
Great, thank you. And to add on to that, Dr. George, I'm curious with you seeing so many more patients virtually now, are a lot of your patients asking you those specific questions as well about social distancing? What should I be doing? What kinds of questions are people asking you along those lines?
Absolutely. I get a lot of the same questions and a lot of the same answers. There is still a lot about this virus that we really don't know yet. So maintaining those measures that we've put in place that have really proven to be effective is incredibly important. Continuing to wear the mask, good hand washing, using hand sanitizer when it's available, the social distancing being key. All of those things, on our side is the same. Even though we're working to be more active in the community, we still need to make sure that those things are key.
Absolutely. For either of you, what are your thoughts on a potential second wave? And this is something that we should be thinking about. This is from Gina.
You want me to take that?
Sure.
Sure. So obviously there's a lot out there about what the future may look like. And internally at Health First, I've been part of all of the modeling that we have used to predict what would happen in our hospital environment. The best analogy that I can provide is when we're used to seeing hurricane models and the cone that's put out by the Weather Service, that is a composite of multiple spaghetti paths or spaghetti models. So in our group, we did multiple spaghetti models of the impact of COVID-19 on our hospital system. So using the same approach with multiple models, we have some sense of what will happen with the virus and the community transmission. Going forward, we're going to continue to use those models, and they get better as we refine the data, as well as looking at the incidence of both COVID-like illness in our region and influenza-like illness in our region. Both of those measures are also followed by the state and available on the Florida State Department of Health website. By monitoring that, we may be able to stay ahead of and in front of any change in the volume of cases and prevent overwhelming any of our emergency rooms and any of our services by managing that disease.
Great. I thought this was an interesting question. Mike asks, is it possible to have the flu and COVID-19 at the same time?
Yeah, as a matter of fact, it is. Initially, it wasn't clear, and we were testing all of our patients that were coming in to the hospital environment for both the flu and for COVID-19, among other respiratory pathogens. And what the literature has told us is that the co-infection rate is as low as perhaps 5% in some regions and as high as 20% in others. The flu season has diminished in our region, but it doesn't mean that people who are traveling might not still experience influenza.
Great. Dr. George, Mia asks, how much does a virtual visit cost?
That is a great question. With the COVID-19 public health crisis, most insurance companies have actually waived their copays for virtual care, and many of those companies that is still in effect, including with Health First health plans, we are not charging copays for virtual health visits. So for the majority of patients, there's no cost associated with a virtual visit.
There's been a lot of talk, Dr. George, about the virtual visits allowing patients to continue that one-on-one personal relationship that they have with their providers. So is it nice to see somebody's, face for the patients that you know? I know it's different than seeing them in person, but how is that a little bit of a different experience than what you're used to as a physician?
That's a great question. It's been an amazing experience on the provider standpoint, getting to see patients really in their own environment, and sometimes having other family members involved with their visits that you may have heard about but not had the chance to meet in person. Sometimes they'll help kind of moderate a virtual visit or just want to come in and say hi. That part of it has been really neat, really getting to know our patients on a different level, really, rather than in our world, in their own world. So that has been a really interesting part. I've had some visits where there have been, like I said, other family members involved, pets involved, things like that. So it's been really fun.
That's interesting. And it's interesting too because even as employees, people are getting used to different ways of communicating with Zoom and different methods. Right. So it's an adjustment for everyone. So Annette is asking about Health First and antibody tests to patients.
Yes, so we are beginning to use the antibody serology test. The antibody test, just for explanation, allows us to determine if someone's developed an immune response to the virus. In the particular use that we are entertaining is to use the test for the IgG antibody, which occurs several weeks after the initial infection. IgM is a different antibody. It will show up very early in a person's infection, but may not confer any long-term immunity. So right now we're focused on the IgG antibody test. We're beginning to test certain cohorts to understand from a population health what that means for the prevalence and the exposure of the illness in our community. And then we will open it up to our providers to test their patients to determine if they've developed an immune response.
That's a very interesting topic that I know we're going to hear a lot more about. Dr. Scheinbart, how is Health First planning for the future of COVID-19 and what happens next?
Yeah, so similar to using the models to predict when and if there would have been a surge in our area, we'll use the same models day in and day out to monitor what is happening in our community. We are fully supplied with surgical masks and PPE, testing equipment, testing reagents to continue to manage the disease as it occurs, which we expect to still occur for quite some time, and be fully prepared. As we see volumes change, we may have to increase our capacities around managing increased cases, and we have mapped all of those strategies out, even to the extent that if this goes on through the summer and into the fall, how do we approach with the schools reopening and an increased number of cases? We have mapped out a variety of scenarios to manage that situation.
Lots of long-term planning, right?
Yes.
This question's for you, Dr. George. Paula is asking, what do you do if your virtual visit requires an additional test, like a strep test?
Sure. So given that our visits are virtual, it doesn't mean that we still can't perform testing if we need to. It also doesn't mean that we can't bring our patient in if we feel that their care really should be done in person rather than virtually. So, if I see a patient virtually and it seems like they might need a strep test, then, we can order that and either do it in our office or in our lab, but bringing our patient in directly, planning for their visit, knowing that they're coming, getting them into a room quickly, helping to reduce exposure, providing them with a face mask and things of that sort to help prevent exposure both to our patient and to the healthy patients who might be in the building, as well as our workers.
Great. Dr. Scheinbart, what can people do? Actually, this is both of you guys as well. What can people do to continue to protect themselves and their families from COVID-19? I think it's, no matter what, it's still a daily topic that we talk about with our colleagues and with our family members, and it's evolving, but it's still constant. So what would you say to people
Sure.
asking that?
So the easiest thing is everything your mom ever taught you was true. Wash your hands. The number one preventative strategy beyond anything we've already talked about is what we refer to as hand hygiene, but it means washing your hands with soap and water for 20 to 30 seconds, or you may have heard the phrase, sing happy birthday to yourself twice while you're washing your hands. And doing that frequent and often as possible, that is a way to take the particulate matter off of your hands so that you don't bring any of those particles into contact with your eyes, with your nose, or with your mouth, which is really the single best preventative strategy beyond anything else we've talked about. But I'll ask you if there's anything else we haven't touched on.
No, I think just on my side that might be a rap tune instead of happy birthday, but yes, I agree. Washing your hands is the most important thing that we can do, for sure.
And there's been also a lot of talk about, eating healthy and staying hydrated, and how important are those things? Obviously, they're always important, but at a time like this, how is it more important for your immune system?
Right, absolutely. So like you said, eating healthy, making sure you're getting appropriate time of sleep and things of that sort, really are going to help to boost your immune system. You can probably speak of that more with your history in immunology, but, making sure we're still maintaining, taking excellent care of ourselves during this time is really important, probably more important now than it ever has been.
When I was a medical student at Ohio State, we used to draw blood on each other as part of an experiment to measure our stress and what was happening in our immune system. And that was 3 decades ago, and those studies have been proven to be true, that stress will impact your immune system significantly. So while stress is an ordinary part of life, how we react to stress is the critical part. Do we go into a fight mode or a flight mode? And that will change all of our body chemistry, our neurophysiology, and lots of other changes to our body. So to the extent that we adapt to the current stress and find ways of lowering our stress and reacting differently, that's a key boost to your immune system. So that might be things like the extra sleep or meditation or doing some exercise in a safe environment to do so. Those are ways to minimize the impact to your health.
Great points. Also, this is a good time to bring up the fact that we are actually offering a free hotline 7 days a week from 8:30 to 4 for our community who has any questions to address the stress piece of this. The phone number is 321-434-7700. Again, 321-434-7700. Our licensed clinical social workers provide safe and helpful options to get the mental wellness care that is especially important right now. So Dr. George, I'll ask you, are a lot of your patients talking to you about that aspect and asking, to Dr. Scheinbart's point of meditating, getting outside and walking, are your patients asking you similar questions?
Absolutely, and there's a lot of discussion and counseling about those points, reminding patients that they can still, go outside and go for a daily walk and make sure they're getting that cardiovascular exercise in a safe way. It might not be the gym, but reminding them of all the different things that they can do, going for a bike ride, exercising in the home and things of that sort. And so there's a lot of discussion about that, and also about mental health associated with the pandemic. I mean, certainly I would say it's nerve-wracking for everybody. And so having an outlet, having, being able to reach your provider and have discussions about your health, I think is hugely important. And just knowing that, in so many different aspects, but especially in your medical care, that, everybody is still here and available to help. Helps to ease a lot of stress.
Absolutely. So Janice has asked, she is supposed to have labs done and an appointment with her PCP in June. What should she do?
So Janice is certainly able to still do those things. Our ancillary services, as far as our lab and imaging, are open. We're trying to continue to reduce the number of patients that we physically have in our buildings. So, you know, if things are routine or on a more preventative nature, some of those things we're putting off a little bit, but that June time frame, you know, as long as we're continuing to do these things in a safe manner, should be fine to come in and do that. Inside of our facilities, we're continuing to do the social distancing in our waiting rooms. The chairs are spread apart. We have the universal masking policy, so all the patients, family members, you know, all of the associates in our buildings are doing everything they can to keep our patients very safe.
Jessica is asking, some people are wearing gloves in public. Is it better to just use hand sanitizer?
You want me to take that one?
Sure.
Yeah, so gloves are very good to protect your own body from biohazardous material, particularly in a clinical environment where, for example, you might be changing the sheets or drawing blood or in contact with any other element of a person's care. But it is not helpful at all in dealing with COVID-19 because, as a matter of fact, what you're doing by keeping your gloves on is moving particulate matter from surface to surface to surface and potentially back to your own body. Unless you're going to do something like wash your hands while you wear your gloves all the time, you really aren't going to prevent any spread of illness by the use of gloves. So why even wear them at all? And again, I think the glove in the clinical environment, when we do something with a patient, we put it on, and then we dispose of them for the very purpose of infection prevention and infection control. So wearing gloves publicly or in any of our environments, I would discourage. Anything to add to that?
I agree. And the first thing we do when we take our gloves off is we wash our hands.
So
again, I agree 100%.
Ailes is asking
how Health First has been treating any COVID-19 positive patients.
Well, so we have quite the experience with taking care of patients in our hospitals, all 4 hospitals as a matter of fact. The primary treatment is supportive care, but essentially it's a disease where there's a lack of oxygen circulating in the body. So for most of the patients that required hospitalization, if not all of them, they required supplemental oxygen. Beyond that, it is giving them plenty of time to rest, making sure they are getting adequate nutrition. And we have used a variety of the treatments that at one point or another seem to hold some promise. And to date, and yet there's still no clear-cut front runner of a treatment, but we have a lot of experience in managing our patients through a wide range of the particulars of their illness.
Do we think, we touched on this a little bit earlier, but do we think that the curve is flattening in Brevard? Is that what we are seeing from a statistics standpoint? Yes,
and myself and my team, we track that on a daily basis since this all began. And it is very reasonable to say, and again, this is available on the Department of Health website, and you can drill down to Brevard County. Yes, the curve has been flattened. And the flattening of the curve was to be able to manage the resources that we have in all of our health systems, not unique to Health First. This is a new illness, something that has not been seen before, and if you have a sudden infection across a large population, no system would be capable of handling that. So to the extent that the flattening allowed us to keep up with the pace of the patients and customers that were seeking our care, yeah, I see the curve has flattened, and that we were able to manage this from a community perspective.
Thank you. Do bandanas work as well as masks?
So no one knows scientifically whether they work as well. But as I mentioned earlier, any barrier that you can present to your own mouth and nose is better than not. And especially if you and the other person that you may be interacting with are wearing masks, you're having a double layer of protection. You're protecting the other person and you're protecting yourself. An N95 mask protects you from 95% of the particulate matter in the range of about 0.3 microns. A general surgical mask can do that about 80% reduction in the particulate matter. So if I'm wearing a bandana and Dr. George is wearing a bandana, at a minimum, there's some reduction in what transmits between the two of us. And so while nobody knows scientifically, if that's all a person had, I would not tell them not to wear the bandana.
Dr. George, are a lot of your patients asking you those sorts of questions, if the homemade masks are as effective, or bandanas? Are you getting a lot of those questions?
Of course, definitely. And, you know, I think the exciting and reassuring thing is seeing how many patients and, you know, people in the community are taking that seriously and wearing their masks when you see them out and about. And so, yeah, we do get a lot of those same questions, for sure.
So this is for both of you. What is the possibility of someone having COVID-19 but not having any symptoms, and how long could they carry it?
Well, could you rephrase the first part of the question, if you don't mind?
Sure. What's the possibility of is it possible for someone to have COVID-19 with no symptoms?
Yes. In fact, most patients, perhaps on a magnitude of 80% of people that have the virus in their system, are deemed or labeled asymptomatic. I think in the future we may go back and be able to ask people what they were feeling at the time that we believe that they had the virus, and they may have had some very mild symptoms that they didn't think of at the time. But for the vast majority of people, and I mean the overwhelming vast majority, will not experience what they consider to be symptoms of the illness. The tricky part of that is that the latest research that's being published is that moment in time before you transition to symptoms is the most contagious time of this illness. So for a handful of days, you may have no symptoms or even continue never to experience them. But if you transition from no symptoms to any of and there are several which we won't go into tonight, that is when the viral particulate matter is most contagious when it comes out of you and to another host. And all the more reason, again, to have masks. If you use the analogy that if your breath were embers that could start a forest fire, and you constantly were breathing out embers, and you sent firefighters in constantly to put out the fire, at some point you're going to harm yourself or harm the firefighters if you keep putting the fuel to the fire. And to the extent that we can decrease the viral community transmission with the use of masks and hand washing and social distancing, I think because we don't know exactly the moment when somebody transfers from asymptomatic to highly contagious and onward to their illness.
As physicians, is this something that you know, that you guys think about, you know, when you go to med school and when you're learning all of these things? Is this something? I mean, we've heard about, you know, flus and things that have happened in the past, but is this something that you guys plan and prepare for and think through ahead of time? I know Dr. Scheinbart does, because I've worked with him a lot recently, but is it something that, you know, you plan for?
I mean, I don't think anybody would ever anticipate having to actually go through this. I might be wrong, but you know, it's something that you hear about happening historically, and we've learned so much from those things in the past. So for this to happen, certainly, you know, I don't think anybody would truly anticipate it. But being able to apply those things that we know, those really, you know, core values, I guess you would say, being able to apply those now are certainly the things that are helping to protect us, just like they would have in the past.
Yeah, I would say that every frontline worker, physicians, physician assistants, advanced registered nurse practitioners, bedside nurses, respiratory therapists, emergency room staff, they all go into healthcare with a purpose. None of us prepared for this pandemic to the extent that we went into the profession to do this work. We're prepared to take care of all of the elements of health and wellness. When this experience began, I was impressed and honored to see the number of healthcare workers in our community and at large that volunteered, that stepped up to the plate, that said, I want to be part of this. I don't want to watch history unfold. I want to be part of this, and that's why I went into it. We train very long and very hard, every person that I just mentioned and those that I'm failing to mention. To do this, it's an honor and a privilege to care for other people when they aren't well. And it's just as honorable to help them when they're well and keep them well. But none of us could have scripted that this is what we would have done back in the day that we made the decision to go to medical school. But everyone that I know has stepped up because that's what we do.
So I spoke with a patient actually yesterday that shared his brother is a nurse. So he's grown up with his brother who's a nurse. And he said it wasn't until he was in one of our hospitals recently that he finally understood and has an entire new respect for healthcare workers because he'd never been on the other side of it. And it took his own personal experience to get that. And then a nurse had shared with me that she thought that this experience had really changed her. She worked on the respiratory isolation units, and she said that the whole facial gesturings and everything is very different. When you're covered, when you go into a room and you're covered, your patients can't see your face and your smile. So I'm just curious, is there anything about this that has changed you guys or made you look at patients or these experiences differently?
Well, I think that like you were saying, how admirable it is that so many people have really put themselves out there to be on the front line and take care of our patients. On the opposite side of things, seeing how much our patients and the community care about us as a medical community as a whole, seeing the parades and the, taking moments to just show their appreciation for the medical community in general. So many patients asking, "How are you?" I'm good. How are you? Taking that moment out of their day to express their gratitude for what we're doing. It's really, I think, really strengthened that bond that we develop with our patients even more.
Absolutely. Do you have anything to add?
Yeah, I think all of us at every level in our organization have been changed by this experience, and I would predict that most people will never forget what this has been like, to delivering a virtual visit or putting on a face mask and a gown to take care of somebody. Those will be unforgettable experiences. But to the extent that it makes us better and all of us as a community work together, I think that there are reasons to be optimistic about things like this. Personally, I'm a silver lining kind of person. I don't want to miss an opportunity to make something better, and I think there are some things that will change us forever. And let's not forget those whose lives have been tragically changed, who have lost loved ones or know of people who have lost loved ones. That's an irreversible moment. And I'm reminded of a story of someone that was taken care of in our hospital environment who did not have COVID-19, ultimately had to go home with hospice. And the family wrote to us about how dignified the care was in the middle of the pandemic, and that not one of our associates or our physicians forgot what was mission critical to this gentleman's end-of-life care. So even in the middle of it, people can rise up and do that which is required. So yeah, I think we've all been changed.
Absolutely. So just again to sort of reiterate, Dr. Scheinbart, Health First is prepared. We are ready. Elective surgeries have resumed. Talk just a little bit about the fact that it is safe to come into the facilities. I know there's been a lot of talk of people being concerned about
Sure.
coming back into doctors' offices and all of that, but can you just share a little bit about how safe it is?
Well, in my own personal opinion, for what it's worth, I believe that the hospital and clinic environments are some of the safest environments in the community. Every person that's in that environment is wearing a mask. Of course, patients in their private rooms that are not diagnosed with any specific illness may not be wearing them 24 hours a day, but all the workers and all the visitors and all the service personnel are wearing masks. So there's a prevention of the movement of the particulate matter that I described. We're practicing hand hygiene everywhere we go. We have plenty of hand sanitizer, opportunity to wash your hands quite regularly, both in the patient room and out in the nurse's station. And to the extent that we are disinfecting doorknobs and hand guardrails and elevator buttons, it is, in my mind, one of the safest places to be. And we continue to provide that disinfection throughout the clinic environment, the laboratory services, the imaging departments. I'll ask for your opinion on that.
100% agree. I think our facilities are probably the safest they've ever been with the amount of precautions that are being taken, you know, on the physical facilities as well as the associates. I mean, you're right. I think that, that our doctors' offices and our hospitals and all the other services that we provide are probably some of the safest places you can be right now.
We continue to screen the associates when they come to work. We continue to screen our visitors. We still have a very limited visitor policy. So it's very hard to get into our environment without having a certain level of precaution, and we'll continue to support those measures for the foreseeable future.
Great. We just have time for a couple more questions. So Dr. George, Jen is asking, do you recommend utilizing virtual visits still versus an in-office visit? So how do you sort of differentiate before that?
Yeah.
I'll ask, and then there's another part to the question, which is it offered for other specialties as well?
Great questions. So yes, to your first question, we are still advising the majority of our visits to be done virtually when possible. You know, we're allowing for some other visits that are considered urgent to be done in the offices, but we are still trying to keep our patients healthy at home and, you know, trying to really emphasize virtual care. You know, in this process, we had started performing virtual care before COVID, but it was in its infancy with the medical group. And as the COVID-19 pandemic occurred, we realized the importance of virtual care and how well we can do it. And, you know, so I think it's something that will stick for many reasons, but we are still asking, you know, the majority of our patients to be seen virtually when possible. But as far, the second question was... Specialists. Oh, absolutely. I think I can say that every single specialty within Health First Medical Group is performing virtual care. So it's not just I've got a cold, you know, do a virtual visit. It's not just checking in with your PCP. It's all aspects of care, cardiology, pulmonology. I don't want to leave anybody out. Orthopedics, hematology, oncology, literally every specialty that we have within the medical group is performing virtual care, and they're doing it really well.
I think just the convenience alone for, you know, for people in their busy lives and having school kids at home now because school is virtual.
Right.
I mean, I feel like that convenience piece is such a great benefit.
I've met so many children on my virtual visits. It's been a lot of fun. But yes, people who are working, who are, you know, in high demand to stay in their position, you know, they're able to continue doing their job while they're waiting for their doctor to be available to do their visit. People are able to stay at home, stay in their jammies, you know, relax on the couch, and then, you know, talk to their doctor about their, you know, chronic illnesses and stuff like that. There are just so many advantages to it. The convenience factor is definitely one of them.
Great, thank you. So probably our last question, who are the most people or the groups of people, demographics of people that are getting COVID-19 the most?
So that's a tough question, because what I want to say is that one of my old teachers in Gainesville said, if you're breathing and have a heartbeat, you can get anything. So the reality is everybody is susceptible to this. We do see an increased amount of disease in the older population. We see that for a variety of reasons that we don't have a whole lot of time to go into. And that population is vulnerable, by which I think both the state and at the local level, we have put a lot of emphasis and energy to protect that, and I do think we've done a very solid job of protecting the elderly. When they do experience the illness, they have a tougher time managing through the oxygen deprivation, and many of them have comorbid conditions such as those with diabetes and hypertension or high blood pressure and pre-existing heart or lung diseases. I think we're also seeing a population who are immunocompromised. I think we're still sorting out what is that definition of immunocompromised, but the elderly with those other illnesses tend to suffer the burden the most. But there are reports of very young, if not infant level infectivity all the way to the advanced elderly. And how we manage them in both the outpatient and hospital environment are particular to their age group and their other conditions. But again, everybody is susceptible to it, and it may impact you differently. But I know of people in a young age group who have been sick from this illness.
Thank you. Thank you both so much. If Dr. George is not going to wrap, then Dr. Scheinbart can close us out.
I'll wrap it up. I'm not going to wrap. I just want to acknowledge the team here. Thank Dr. George, Jenny for moderating, and all of our viewers. I think that Health First is here to serve our community, and we're prepared for whatever the future holds. And again, thank you all for participating tonight.
Thank you.